Today, among the most exciting advances within the diagnostic imaging field is molecular breast imaging, and for good reason. The technology is helping physicians and patients see what matters most in diagnosing breast cancer. The procedure, breast-specific gamma imaging, or BSGI, may have saved Patty Daniels' life by providing early breast cancer detection.
If I had not had the BSGI done, I may have gone another year before my next mammogram, and who knows where this tumor would have been at that point in time.
The Dilon 6800 gamma camera is a high-resolution gamma camera optimized to perform BSGI, a procedure that aids in the effective management of suspicious and difficult-to-interpret breast cases. The gamma camera captures vital information by viewing the metabolic activity in the breast. It can identify lesions independent of tissue density and is capable of duplicating standard mammographic views.
Breast-specific gamma imaging is a molecular imaging of the breast. It looks specifically at the breast and the tail of the breast. It's meant to pick up areas of abnormal activity that may represent cancer formation. It's helpful in scenarios where we've identified cancer to help us determine extent of disease or maybe additional sites of cancer in that breast.
Doctors, patients, and insurance payers enjoy the benefit of BSGI and MRI being used interchangeably in the diagnostic workup of a patient, as the two imaging tests have comparable sensitivity for detecting cancers, and many studies show that BSGI has greater specificity, which means that it is more effective in differentiating benign from malignant tissue. And BSGI costs significantly less than MRI, up to 70% less. All this translates into more cost-effective medicine.
One of the downsides of MRI, particularly in women with more active glandular tissue, is that we tend to see false positives. What that means is areas on MRI that light up and indicate that there is some activity there, but it is less specific. It's a very sensitive tool, meaning that it does show areas of activity, but it can be less specific, meaning we don't know whether that activity is just normal hormonal activity or if that's actually cancer activity.
BSGI offers a number of important benefits. It provides fewer false positive rates with fewer patient restrictions than MRI. It helps evaluate the need for and localize areas of interest for biopsy. It aids in determining the extent of disease, and it is helpful for women with dense breast tissue.
One of the main areas that we use this for is in the daily workup of patients. The area where we find the most difficulty with mammography is women with dense breasts. That's where we miss at least 10% of breast cancers. Luckily, this new test does not depend at all on breast density. So we can use this new modality for looking at these women, especially if we see anything moderately suspicious or slightly suspicious on their mammogram.
Dilon continues its mission of delivering leading-edge technologies that may save and change lives like that of Jennifer Holmes.
I'm 34, I'm married, and I have 3 small boys, 11, 7, and 5. So it was very frightening when I found this lump, because the first thing you hear when you think cancer is, oh my God, what am I going to do for my family? The BSGI really helped me in my decision making. They definitely found something on my left breast, and when they went to do the right breast, they saw some abnormal tissue. As soon as I heard that there was something worrisome on the right side as well, I just automatically decided when it comes time to have surgery to have the double mastectomy.
For more information, go to Dilon.com or ask your physician if BSGI is an option for you. For 21st Century Health, I'm Lori Ann McGregor reporting.